Hello dear patients and followers of our YouTube channel. I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today I would like to share the results of our patient who underwent the hair transplantation surgery in our clinic 2.5 years ago in August of 2023 with 3,500 grafts. This is a 26-year-old white male who had the mixed type of the hair loss, no root type 5 to no root type 6. Why it's called mixed type of the hair loss? Because the front side and the mid scalp as a hair loss pattern is closer to no root type 5, but the crown area due to its size and opening area is closer to no root type 6. The patient went through a thorough evaluation before surgery and during the planning steps of the surgery. As mentioned earlier in our previous videos, the first thing we always do when we evaluate the patients, we see what's the degree of the hair loss the patient has. And we use the Northampton scale for this purpose. And on Northampton scale, the hair loss in man is basically staged starting from level 2 up to going to level 7. 2 is the lowest and 7 of course being the highest level of the hair loss. The higher the degree of the hair loss the patient has, high is the need for the grafts we need to get, and high is the probability that some patients may require to get more than one surgery to have a good coverage and the density. So, as mentioned earlier, it's a 26-year-old white male with the no root type 5 to 6 of the hair loss. He underwent the hair transplantation surgery with 3,500 grafts. His top priority was the reconstruction of the front hairline, covering the front side and adjusting the mid scalp as much as possible. The front frame of the face, as we most of the time call it, because whenever people see you most of the time, 60 to 70% of the time, the people see you mostly in this area. So especially with the progressive type of the hair loss, we always advise the patients to go with the classic two-step surgery. When with the first surgery we rebuild the front hairline, cover the mid scalp, and try to go as much as we can depending on the number of the grafts. Why we advise to prioritize the front side and the mid scalp? First of all, because most of the time, whenever you see yourself in the mirror, when you take the pictures, when you go outside, when you enter the door, the first thing that people always notice is this front area. We call it, that's why it's called sometimes the front frame of the face as well. So the patient has 3,500 grafts. Out of this number, 2,800 were used in the front area and 700 was used in the mid scalp area. In the pictures you can see that the patient also has a good amount of the hair in the mid scalp and the crown area. The only thing that they are really thin, we call it the miniaturized hair, or the hair that are under the effect of dihydrotestosterone and going through the stage when all the time, if the proper prophylaxis is not taken, they can still lose the hair. So he went with the surgery, and after the surgery we definitely advised him to stick up with the medical treatment, finasteride and minoxidil, to prevent further loss of his non-transplant hair and try to revoke the pre-existing hair yet. And now you can see his results exactly 2.5 years after the surgery. You can see the front hairline is redefined, it's solid, it's visible, the front area is covered, and the mid scalp has a good coverage. There is some thinning and the miniatures in the crown area as well, but alongside with the medical treatment you can see, compared to the initial pictures, how well it has been reestablished and reinforced. So this is a good example when the hair transplantation surgery alongside with the medical treatment has a very good synergistic effect and gives the patient more fuller outlook of the hair. Also, when I was talking about this patient, one of the things I want to mention is these medications are efficient unless you use it. Once you quit using this medication, finasteride and or minoxidil, of course the natural hair loss pattern can be back. So the patient is happy, we are happy, and that's one of the examples how the surgery can be life-changing. If you have any questions or you want to get more details about the hair transplantation surgery and treatment in our clinic, please leave the comment underneath the video. We'll be more than glad to answer them. Thanks for watching us and stay tuned.